All this week, we've been sharing some powerful stories of people around our region whose lives have been impacted by lung disease. Tomorrow, many of those individuals will gather with the American Lung Association in Pennsylvania and the local community for the annual Lung Force Walk here in Philly.
And a team from CBS News Philadelphia will be there as well for the walk that supports research, education, and advocacy. And for a local man, those breakthroughs in research have been key to his fight. He shared his story with me.
He was 43 years old with a vibrant life and family when Michael Hu knew something was wrong.
Just really sharp pain in my side. I couldn't take a regular breath in without it hurting.
A trip to the emergency department led to a series of tests.
They found lesions in the background of my liver and then eventually in other parts of my body.
It was cancer and stage 4 in his liver, lungs, pancreas, bones, and brain. They later determined it was lung cancer. And Michael is not a smoker.
You're in this shock of where your world falls apart and you're trying to just put things back together.
And this was severe.
It was very severe.
Dr. Chris DeVella is a thoracic medical oncologist at Penn Medicine who examined Michael during his first ER visit and oversees his care.
We have had a rise in non-smoking related lung cancers, and what we know is that there are certain targetable mutations, so mutations in the tumor that drive its growth.
For Michael, his immediate thought was his young kids.
That was probably the first thing that came to my mind, not even like me being sick, but what it means for my family.
Because of breakthroughs in research with advanced biomarker testing and sequencing, they were able to provide him targeted drug therapy.
The thing that's been game-changing is that the amount of people that have shrinkage of the drug can be close to 80 to 90%.
I'm always more mellow nowadays.
It's been 3 years, and while for Michael there have been some setbacks, because of the treatment, he's now able to look to the future and also advocating for more research and resources for lung cancer treatment.
Knowing that there's so much more on the horizon, it's exciting, but also for a patient like myself, it can't come fast enough.
Such a remarkable story of strength and hope, and using his story to become an advocate now for others. And that's why it's so important what's happening tomorrow. Funds raised through the Lung Force Walk support lung cancer research and education. And you can sign up and join us for the walk tomorrow by going to lungforce.org/CBS Philadelphia. Again, tomorrow morning at the Philadelphia Zoo. You can register right now online. And it was so brave of Michael to share his story. He's going through so much. He looks great, but he says he is still fatigued, extremely fatigued from the medicine that he has to take to keep fighting this cancer. But it's amazing how much progress they have made because of research.
Which is stage 4.
Yeah,
I was like, wow.
Yeah, it is remarkable, but a testament to the research and the medical teams who are behind this.
Hopefully a lot of people show up tomorrow.
Yes.